The next country on my tour couldn't be more different. Our family lived there twice. I was the Tokyo correspondent for the Washington Post.
Japan has 130 million people, and whenever I come to this station in Tokyo, I feel like every one of them is right here. It's a ferociously capitalist economy. They have no natural resources, but they've built the second richest country in the world. And you know, it's 130 million healthy people. They have better national health than we do. They cover everybody, and get this, they spend half as much as the United States on health care per capita. How do they do that?
One thing's for certain, Japanese healthcare is a bargain. For just 8% of GDP, that's less than even the British spend, the Japanese have built a system with fabulous health statistics. They have the longest healthy life expectancy in the world and the lowest infant mortality rate. Now, part of that's due to diet and lifestyle, but the health system must be doing something right. Everybody's covered, but unlike the Brits, the Japanese don't pay for all of it through taxes. Instead, everybody has to sign up for a health insurance policy. You get it at work or through a community-based insurer. The government picks up the tab for those who are too poor. This system is known as social insurance, and it's a model that's used in many wealthy countries. As for the healthcare itself, that's certainly not socialist. 80% of the hospitals are private, more than in the US, and almost every doctor's office is a private business. Dr. Kono Hitoshi is a typical doctor. He runs a private 19-bed hospital in the Tokyo neighborhood of Soshigaya.
一番いいのは皆保険制度。誰でもどこでも気軽にいつでもお医者さんにかかってお金が安いと。
The Japanese are prodigious consumers of healthcare. They go to the doctor 3 times as often as Americans do, and since there are no gatekeepers, they can go see any specialist they want.
その患者さんは約束しますか? Do they have to make an appointment to come?
No. 約束いらない。
Never.
Never.
顔と顔は何分ぐらい? How long do you see the doctor?
3 minutes.
It seems like such a short visit.
じゃないと物理的に無理っていうか時間が足りない、まあ一人に対して長い人もいれば、血圧だけ測って、薬出して帰っちゃうっていうもう1分ぐらいの健康診断みたいな、早い人もいるんで平均すると3分から5分っていうのは。
Surveys show the Japanese are highly satisfied with their health system.
やっぱり検診がとても助かってます。いろいろ測ってもらいますから。そう、だからそのために健康なんじゃないかと思ってますけど。
You know, she says, you know, this annual physical is really a great idea. I think that's why I've stayed so healthy, because they really look out for me and check out all my problems.
負担もね、健康保険が充実してるからね。悪くないと思いますけどね。
Yeah, well, it's not bad, as a matter of fact. You can't call it bad because everybody has the insurance, and the insurance pretty much takes care of the bills.
私は医療国民健康保険があるので、すごく日本はこの制度はいいと思います。
So I think the Japanese healthcare system is really good. I know nothing about other countries. What do people in your country think about your healthcare system, she says?
Here's something else that's different. Japanese patients have much longer hospital stays than Americans, and they love technology like scans. They have nearly twice as many MRIs per capita as Americans, 8 times as many as the Brits. So how do they keep costs under control? Well, it turns out the Japanese health ministry tightly controls the price of healthcare right down to the smallest detail. Every 2 years, the physicians and the health ministry negotiate a fixed price for every single procedure and drug. Like the items in this sushi bar, everything from open heart surgery to a routine checkup has a standard price. And this price is the same everywhere in Japan. If a doctor tries to boost his income by increasing the number of procedures, well, then guess what? At the next negotiation, the government lowers the price. That's what happened with MRIs, which are incredibly cheap in Japan. I asked the country's top health economist, Professor Naoki Ikegami, to tell us how that happened.
In Denver, where I live, if you get an MRI of your neck region, it's $1,200. And the doctor we visited in Japan says he gets $98 for an MRI. So how do you do that?
Well, in 2002, the government said that the MRIs, we are paying too much. So in order to be within the total budget, we will cut them by 35%.
So if I'm a doctor, why don't I say, well, I'm not going to do them then? It's not enough money.
You forgot that we have only one payment system. So if you want to do your MRIs, unless you can get private pay patients, which is almost impossible in Japan, you go out of business.
So that shafts the medical device makers and must limit innovation, right? Well, no. Japanese manufacturers of scanning equipment like Toshiba found ways to make inexpensive machines they could sell to doctors, and guess what? Now they're exporting these machines all over the world. But price regulation also hits the doctors hard. Dr. Kono can't charge what he wants. He can only charge what the official price book dictates.
こちらの間違いですから、それはまた書いて、こうやって全部例えば傷ですねこれ。傷で100平方センチ以下だと450円治療費。全部こうやって値段が書いて。
If somebody comes on the cut that's less than 6 square inches, so a fairly small cut, he gets 450 yen, $4.30 to sew that up. 大変安い. It seems incredibly cheap.
非常に安いです。部屋代はまあ大部屋って4人部屋。
He then told me what it costs to stay in his hospital.
個室だと1万円。
Okay, you'll love this. So you know how much it costs to spend the night in the hospital here, according to this price book? If you stay in a room with 4 people, $10 a night. If you have a private room, $90 to spend the night in the hospital in a private room here. That's because the government set the price.
日本全部。
日本全部。
全部同じ値段。
そして東京の祖師ヶ谷区でも短い島でも沖縄の南の短い島。それはフェアですか? Is that fair?
フェア。
Oh, it is.
これはもう非常にフェアな。やっぱりドクターは金持ちになるなと。
The doctors have to live with the price book, but Japanese patients have to play their part in financing the system by paying into a social insurance fund. If you lose your job in Japan, you don't lose your health insurance. Unlike the US, you switch to a community insurer. And these insurance companies have very little in common with their American counterparts.
Can they turn her down if she has heart disease or something?
That is forbidden.
These health care plans covering basic health care for a worker and his family, do they make a profit?
No, because they are not allowed to make a profit, and anything left over is carried over to the next year. And if there's a lot carried over, then the premium rate would go down.
Insurance companies barred from making a profit. National price regulation. That's all good news for patients. The average premium for a Japanese family is just $280 a month, with the employer paying at least half. A lot less than most Americans pay. It's good news for Japanese employers as well. JR Tokai, the company that runs this bullet train to Osaka, told me that its healthcare costs are about half of 1% of operating expenses. General Motors pays 8 times as much as that. So here's a country with the longest life expectancy, excellent health results, no waiting lists, and rock-bottom costs. What's not to like? But the president of the Nagoya Central Hospital, Professor Saito Hideto, showed me the downside.
I think our system is pretty good, but no system is perfect.
Yes.
But now 50% of hospitals are in financial deficit now.
No, I didn't know that. In Japan.
50% in Japan. Yeah. So I'm afraid hospitals maybe one of the endangered species in Japan now.
50% in financial deficit? That sounds unsustainable. So here's the weakness. While we spend too much on medicine, the Japanese seem to spend too little. In a country with $10 per night hospital stays, the prices are just not high enough to balance the books. But the Japanese system is so popular that they're not going to rip it apart. The experts say they'll have to increase prices a little to save the hospitals from going broke. Back home, our problem is patients going broke.
In Japan, how many people go bankrupt for medical costs?
I don't know. Perhaps Mr. Ito know? No. その医療費が払えなくて破産する人ってほとんど聞いたね。Yeah. We never heard of it. Yeah. Almost never heard of it. Yeah.
Before leaving Tokyo, I went to the Meiji Jingu Shrine, a deeply spiritual place. I left a prayer asking for something I think almost all of us can agree on. A health system where, as in Japan, everybody gets care and nobody goes broke paying doctor bills.